Good morning. Good morning. Welcome to Health Check. I'm your host, Dr. Vanessa Bolling. Health Check, as you've been hearing, is sponsored by Kingdom Health Connections, which is a health promotional resource center where it's all about cultivating a culture of health, wellness, healing for you and the entire family. And that's done through health promotional information, health education, as well. As you've been seeing me every Tuesday here at 9 a.m. on YouTube as well as Facebook. Well, come on in, share this with your information, share this with your sisters, your brothers, your family members. Let's promote a culture of health, wellness, and there is healing too, as well. The more we know, the more we can become accountable and the better we can live our lives so we can make sure that we maintain this culture of health, wellness, and healing for our lifestyle, for our children and our children's children. As I mentioned, I'm your host, Dr. Vanessa Bolling. All throughout the month of October, we are talking about breast health tips. We know that this is Breast Cancer Awareness Month, but we can talk. I would like to talk to you about ways in which we can promote good breast health. This is for men as well as this is for women as well. So come on in, share. I pray everyone is having an awesome and an amazing Tuesday morning. Today, I want to talk about breast lumps. Last week, I mentioned breast pain and how that can trigger a lot of anxiety. It can trigger a lot of fear. It can be very alarming. But I hope that I was able to provide some reassurance that breast pain standalone is commonly not associated with breast cancer. We think breast pain, we think breast cancer. When it's standalone, so there's only breast pain and nothing else is going on, it is commonly not associated with breast cancer. But of course, there are things that we can do if you experience breast pain. I talked about some other reasons as to why breast pain can be present. If you're interested in that, maybe you've experienced breast pain, feel free to go back, look at hashtag replay, look at what I talked about last week here on Facebook or YouTube, and just get acclimated. It's always good to know what's going on baseline. Today, though, I do want to talk about breast lumps. This is another alarming finding. It can also trigger anxiety. It can trigger fear. So let's talk a little bit about breast lumps. As I am a primary care provider, I see this a lot in practice, and hence why I want to bring this up. I don't want to downplay any of these symptoms at all. I would not recommend you just ignore them, but I just want to speak to those who might have experienced breast lumps. Maybe it's been cyclic. Perhaps you have one right now and you're fearful. I just want to help lower some anxiety and some fear around breast lumps, though it is something that may be an abnormal finding for you because it's not something that you've normally had present. I just want to bring some hope, bring some peace, settle your emotions a little bit where these things are concerned. Of course, go ahead, get evaluated. Of course, check in with your primary care provider, your specialist. Maybe you're seeing a breast specialist because of family history reasons. But I just want to bring some help to bring forth some sobriety of mind concerning these topics. So breast lumps, there's so many different causes of breast lumps that are not related to cancer. So it could be a breast cyst. So a cyst is just a fluid-filled sac that's filled with fluid. Um, and this can happen if there's blocked breast glands. A cyst can form. Again, cyst is a fluid-filled sac that can form in the breast. And typically cysts, they can be large, they can be small, they can change in size. They can even disappear, especially after your menstrual cycle. They can begin to disappear. It's very common to have breast cysts between the ages of 35 and age 50. Also being closer to that menopausal age, you'll find breast cysts to be a little bit more common. And you can have some tenderness too, because you think of it, a cyst is formed where typically nothing would be there. So it's taking up some room. It can cause some tenderness around the area because typically a breast cyst wouldn't be found there. Breast cysts can be solid. They're usually round, well demarcated. So you can really kind of feel the borders of that cyst. It's usually circular too as well. So that can be a cause of a breast lump. Completely benign, completely non-cancerous, and it actually does not increase your risk of cancer either. So rest assured that if you might have found a breast lump, it may be a breast cyst. So let's not go down the cascade of things that could be happening. So it's always good to know, again, it's all about health promotion here, this culture of health and wellness, healing as well, knowing what is your norm, knowing what is a regular finding for your body. Breast lumps can also be caused by fibrocystic breast changes. So this typically happens when you have your menstrual cycle. So the breast can be tender, breast swellings, breast fullness. The breast tissue can be a little bit more rigid or firm in a sense. And there can be different portions of the breast that can be a little bit more firm than others. Cysts can form then, but then it can also go away as soon as your menstrual cycle goes away. So that's what is correlated with fibrocystic breast tissue. A lot of the breast tissue is fibrous, so it can be more pronounced around the time of your menstrual cycle. Hence the breast fullness, tenderness, breast swelling too as well. That can be present. So rest assured, especially if you find these things around your menstrual cycle. As I mentioned last week, if you notice some breast pain around your menstrual cycle, usually that 5 to 7 days prior to your menstrual cycle, you're having these fibrocystic breast changes. So you'll have some tenderness. You may find cysts, but they go away and they disappear. Another cause for breast lumps is fibroadenomas. And these are benign tissue masses or tumors. I mean, those words can be very frightening, but they're completely benign. So they're non-cancerous. Yet again, they are solid. They are also firm. And it's very common to see fibroadenomas between the ages of 20 and 30. Very common to see this. So they're smooth. And something else to keep in mind, fibroadenoma, they are mobile. So they're not stationary in the breast tissue. So you can move it around. It may have like I said, they're solid. They may have a rubbery consistency to them as well. They're firm, but they can move around in the breast tissue. It's not stationary in the breast tissue. So something else that's a little bit more reassuring. You can find fibroadenomas around the time of menstruation. Someone who is during the menstruational ages, you can find that then. If someone is pregnant, if they're on hormone therapy, it's common to find fibroadenomas as well. And that could be a cause of a breast lump. Another cause of a breast lump that I actually didn't write here is a lipoma, which is just a fatty tumor. It's a fatty tissue mass, also very mobile, rubbery consistency. So you can poke it and it changes its not texture, but morphology a little bit. So it changes its shape a little bit. And it's just fatty tissue. Lipomas can also form in the breast as well. So there are very many causes of breast lumps, but don't have to be breast cancer. When cancer may be correlated with the breast lumps is when they're painless, when they're firm, solid, they're not moving, they're not mobile, they're not rubbery in consistency. If it's pitted, so the skin may start to look red. When I say pitted, I think about the orange peel, an orange peel. You see those little dots in it? That's what you can correlate with being pitted. So red, firm, non-mobile, so it's stationary, it's sticking to the skin, or it's in the chest wall. It could be, but it does not mean that it is. So again, you see the obvious difference between the breast cysts, the fibrocystic breast changes, fibroadenomas, lipomas. You see the obvious difference with them. So rest assured, be at peace. Be at ease, take it easy. If you've noticed that you found a breast lump, there are things that you can do. One, I already mentioned it, knowing what's going on with your breast tissue to begin with, recognizing you want to check your breast tissue regularly, not around the time of your menstrual, of course, because things change. As I mentioned, those fibrocystic changes can happen, but just knowing your norm, knowing what your breast tissue feels like, and notice and being aware of what's going on with you, to recognize when something is different. If you notice that something is different, if you notice a breast lump, whether you have a family history of cancer or not, it's okay to observe it. Consult with your primary care, get some reassurance on it, make sure you're aware, but we don't want to ignore what may feel abnormal to us. But I want to help you in your thought process. Perhaps you may experience this or have found this. Be rest assured, it does not have to be cancer. It may not be cancer at all. So let's nip fear in the bud and be reassured that, listen, it doesn't have to be cancer. Just know your norm. Get your evaluations regularly. If you're at the age of getting mammography screenings, you may even need an ultrasound. That's something that we're going to talk later on in the month about. You want to keep up with those screenings regularly and also screen yourself. Be aware of what's happening with yourself. But I pray that you are blessed today. As we know, we've heard the information. Let's be accountable to this. Let's hold one another accountable. Maybe you have a sister, you have a friend, you have a brother. They've been ignoring a lump that's been there. Something else that I want to keep in mind too, with cancer-related lumps, they're usually not regular bordered. They're not circular. They're not well demarcated. They may have an irregular border to it. So if you have a friend or sister or a brother that has recognized a lump in their breast that's irregular bordered, or maybe just round, and they haven't checked on it, encourage them to check in on it. Share this broadcast with them. It doesn't always have to be a threatening thing that's happening. And I know it can trigger fear, but let's nip fear in the bud, become sober-minded about this, and realize that it does not have to be cancer. So let's nip fear in the bud. Let's take on that sober mind, that love mind, that power mind, that soundness of mind, and just do what we need to do to make sure that we remain in good health. Get checked. As you know, this is health check. Get checked, and let's be aware of what's going on so that we can live and not die, so we can declare the works of the Lord, Savior Jesus. Not only that, but our descendants will live as well. If you have questions, feel free to put them here on the broadcast. Also email me at kingdomhealthtah@gmail.com. I'll be sure to answer your email. I do go back and I do look at the responses as I just try and get the information out there and go back and respond and dialogue with you after. I pray that you are blessed. Go ahead and put hashtag I choose life. Hold yourself accountable to it. How are you choosing life today? Is it with being aware of how your breast tissue typically is? Perhaps you're a man. It doesn't matter if you have a family history of breast cancer or not. Hey, go ahead and put hashtag I choose life. Say how you're going to choose it today. But I pray that you are blessed. As always, I'll see you here again on Health Check, sponsored by Kingdom Health Connections. I am your host, Dr. Vanessa Bolling. As always, every third Sunday, be reminded that every third Sunday at the Apostles' House on the upper level, we are hosting the blood pressure clinic this coming Sunday after our 11 a.m. service. Come get your blood pressure checked. Come get your heart rate checked too as well. As we check our spiritual heart, let's also check our physical heart as well. You'll see myself or any of the blood pressure clinic team members. We will be there to greet you with a smile, demystify the fear of checking in on your physical. But we're here to encourage you in your journey and your lifestyle of health, wellness, and healing. Like I said, I'm Dr. Vanessa Bolling. I'll see you here again next week, Tuesday, on Facebook as well as YouTube at 9 a.m. Be blessed. Bye-bye.